Are you tired of all your nursing friends going on break without you because you are stuck with another patient going into a fatal cardiac arrhythmia? Have you held your bladder for far too long and walked past your patient's room only to find the monitor like this? Well, then, do I have some great news for you? You can turn your patient off and back on again with adenosine. Adenosine blocks the signal for electrical current through the heart. You might be thinking, wait, don't you mean it just kills the patient? And yes, I do. Thanks for asking, but only briefly. It slows conduction through the AV node of the heart to allow it to kickstart up again properly. When you give adenosine, it slows the cardiac conduction through the heart, specifically in the AV node. We are hopeful always that this will reset the patient into a sinus rhythm. The half-life of this medication is less than 10 seconds, so you have to be quick. With such a short half-life, you need to consider what IV you're using. You're not going to want to use something far away from the heart, like a foot IV, for example. It's going to slow the cardiac conduction, and then it's going to pause. The patient may feel awful, like they're dying, having a heart attack, lightheaded, dizzy, tingling in the arms, nauseous, low blood pressure, irregular heartbeat. They're going to feel horrendous. You should probably warn them that that is a normal and expected result when using adenosine. It will be short-lived thanks to its half-life. Some contraindications include patients with asthma, COPD, heart failure, heart block, or severe hypotension. You're not going to want to stop their heart. We start with 6 milligram IV rapid bolus, and if it doesn't listen the first time, you can go up to 12 milligrams. It's best to use a 2-syringe technique, which I did not have for this video, using a Y site, and flushing with 20 mils because you want that to get to the heart. Lifting the arm is also helpful. Use gravity to your advantage. So let's go back to our patient here.
Okay.
Cross your legs, hold your bladder,
Hurry.
use that Y site, flush with 20 mils, hold the arm up, and pray if you're spiritual. Keep praying. And there you have it. Back to normal. Everything is awesome now. Your patient might need a hug. Just cover their bum, please. They can go back to their regular activities so long as nothing else is going on with them. Maybe they get a little work done. Get back to the activities they love, like women's fastball, watching the big game, and hanging out with friends. And you can walk into the break room like this. Just please don't bring your gloves in there. Now you can have that well-deserved break. Maybe even take a nap. Everything's better now that you turned your patient off and then on again. You could even catch up on some of your charting. See? Longhand charting. That's how it looked when I started. So don't be like Evie. Don't make it harder than it has to be. Just start by trying to turn your patient off and then on again. And then no one has to go to the dying place. And you can feel like a hero.